Well, it is just past noon Eastern, and I always like to start these on time. Of course, other folks may join us as we get started, and that is perfectly fine. But I want to welcome everyone who is joining us live and also welcome everyone who might be watching this recording after the fact. We're glad you're here. So want to welcome you to our June edition of the ICA's Expert Speaker Series. Before I turn the floor over to our wonderful speaker today, I want to just talk through a few things, let you know a little bit about the organization that is hosting this Expert Speaker Series, and just talk through a few logistics, and then we'll get to the good stuff. So first of all, I want to make sure you know that the Interstitial Cystitis Association is the host of this monthly Expert Speaker Series. We've been around for just over 40 years, and we are proud to say that we are the only national nonprofit in the U.S. dedicated to serving the interstitial cystitis bladder pain syndrome community. We are led by a group of people who care very much about this community. So in addition to the staff, I'm the executive director. Hi, Laura Santuri. We have a wonderful board of directors and a medical advisory council full of people who either have the condition themselves and know firsthand what it's like to live with it, or who care deeply about the patient community because they are a friend or family member of a patient, or they are a healthcare provider in this particular community. In addition, we really try to fulfill our mission through three primary mechanisms. We are regularly engaged in advocacy, working very hard and kind of in the throes of that right now to make sure that, for example, research funding is not just sufficient, but meaningful, so that we can continue to explore what causes this condition and effective treatment strategies. We are very engaged in education and have a variety of things that we do, anything from our ICA Update, which is our award-winning magazine, to a comprehensive website, to this particular speaker series. We are also very engaged on social media and our online community, and importantly, trying to provide safe spaces for our community to engage with one another. Just a few logistics before I introduce our speaker. If you are new to Google Meet, so you will notice that at the bottom of your screen, you have a little closed caption button, little CC in a box. It's actually pretty accurate. So if it is easier for you to follow along with closed captioning, you can turn that on for yourself. If at any point you'd like to share a reaction, there's a little emoji reaction button. There are a variety that you can select from. Hopefully we're not getting any thumbs down today, but there's lots of reactions that you can share there. As I mentioned at the start, we have the camera and the microphone features disabled, but you can engage with us via chat, and that chat button is just at the bottom right-hand corner of the screen. Feel free, if you've got a comment or a question throughout the presentation, you are welcome to go ahead and type it in and put it there, and we will make sure we come back to it during the Q&A session. Also, just in case you need to adjust your settings, just want to show you those three little dots and then the settings option. This is especially helpful, for example, if you're not sure if the sound is coming from the right place, or maybe you need to adjust your volume, you can do that there. So I am going to stop sharing at this point, and I'm going to let our speaker, if you have slides that you'd like to bring up, you're welcome to do that. But I want to introduce our speaker today. We're incredibly grateful to Sabrina Saro, who is with us today to talk to us a little bit about why therapy belongs in our IC treatment plan. Sabrina is a Columbia University trained licensed clinical social worker, certified clinical trauma professional, certified DBT practitioner, and a memoirist. As a Black, queer, and trans provider, they have extensive experience working with LGBTQ+ and BIPOC patients of all backgrounds. Their goal is to facilitate trauma-informed and culturally sustaining wellness and joy for all of their patients navigating chronic pain, relational distress, anxiety, and dysregulation of any kind. As a pelvic pain experiencer themselves, they have done extensive work with the pelvic pain community as one of the leading Black psychotherapists to hold a subspecialty in working within the intersections of pelvic pain and mental health. They're currently pursuing their doctorate, excellent, aiming to contribute to research around BIPOC communities and chronic pain, and have been featured in numerous pelvic pain advocacy organizations. So we are just incredibly grateful to you, Sabrina, for you to be here today and to share your experience with us. And without further ado, I'm going to turn the floor right over to you.
Thank you so, so much, Laura. It's truly an honor to be here, to be doing this expert series today with ICA. And I just want to say thank you so much. Welcome, everybody. I'm so, so excited to just be in dialogue with you all today. And let's kick it off on why therapy belongs in your IC treatment plan. So I'm just going to start with talking to you all a little bit about what is therapy really. I know it's a word that we are all familiar with. We hear it often, but I wanted to spend some time talking a little bit about what the relationship is on a more molecular level. So I always like to describe to folks that therapy, first and foremost, is a relationship, right? Beyond existing within the medical industrial complex, it is one of the most intimate relationships that can exist, really, between a clinician and a client. Therapy is really a container meant to help you understand your values, your passions, your experiences, your pain, your pleasure, but most importantly, your complexity, right? And as I'm sure many of us who are present here today know, IC is an incredibly complex condition, right? It speaks back to so many different aspects of the body, the psyche, the self. And so I like to describe therapy as one of those multifaceted containers in a similar way, where it's really there to hold and honor all of your complexity. I think also, too, a lot of folks think of therapy simply as just talk therapy, which is not incorrect. It is one of the primary ways that we treat and support folks. But I like to describe therapy as a container that often goes far beyond just talking about your feelings, right? So where talking can definitely be a main cornerstone of care, therapy can involve numerous techniques ranging from somatic awareness to body mapping, breath work, advocacy skills practice, right? And really skills that really range deeply across multiple interdisciplinary, themes such as EMDR, IFS, nervous system upregulation skills and tools. So I just like to pause here and, really make folks aware that, yes, you are talking a lot in therapy, but we have the fortune right now of dipping in and utilizing several different modalities that can really speak to your specific learning style, your specific interests, your specific history. It doesn't have to be just showing up, talking, or what I like to call regurgitating the contents of the week, right? Sure, it can involve that, and that certainly can be helpful and beneficial, but there are actual evidence-based protocols, modalities that can really help you from a body perspective, release and move some of the pain you are experiencing on a physical level out of your body. So the emotional cost of IC, which is a big one for many of us. Right, so I just want to start off and honor that all chronic illness is difficult, right? Whether it's IC, whether it's endometriosis, right? It could be anything. But I think in particular, chronic illness can be especially debilitating when folks cannot generally see or fully grasp, right, the depth or the range of symptoms that one often experiences with IC, right? And so I just want to honor right now for all of us that living with IC is really, really hard, right? Not only is it an especially niche diagnosis, but I often find and hear from my patients that it's one that doctors and medical personnel, by and large, tend to really misunderstand and miscategorize, right? Like even in New York City, a densely populated city with excellent medical personnel, I'm still often shocked by how many people look at me when I say, the initials, right? Or when I say interstitial cystitis, right? It's still a sort of nebulous, it mystifies folks still, right? And it goes without saying that IC is incredibly psychologically exhausting and demanding, right? Symptoms often vary and change day to day, right? We know that there's a whole host of theories and, experiences that deeply inform how our flares often show up, whether that be the menstrual cycle, sex, intimacy, stress, anxiety, depression, environmental triggers, right? Food choices, infection, right? And not to say that IC is infectious based, we know that it's not, but right, folks might have a UTI or might have another infection that can certainly increase their flare or increase their propensity to having a flare. So I just want to honor the emotional cost of IC, which I'm sure is one that none of us are strangers to, but just wanted to take some time to really highlight that this is an incredibly challenging condition, and it speaks back to all parts of ourself. So to move forward along that through line, right, patients will often describe and report withdrawal, social isolation, fear of intimacy or fear of relationships, fear of dating, fear of sustaining their relationships, right? They'll often experience and report medical gaslighting, right? Medical mistreatment, right? And I think this goes without saying, all of us can experience and are susceptible to medical gaslighting, but there is often a disproportionate rate of folks of color, folks of trans experience, gender expansive folks who are also reporting medical gaslighting in different ways, right? And so medical racism, I'm going to add to that, anxiety over food, right? Over vacationing, going to dinner, travel. My goodness, right? Like getting on a plane, getting on a bus, having a long car ride, and overall upregulation in their nervous systems, which we're going to talk about in some later slides, but just what we like to call in psychotherapy central sensitization, which essentially just means when your nervous system is responding disproportionately to any sort of threat or stimuli in a way that is upregulated, right? So it could be a slight threat that might not ordinarily produce a nervous system response in somebody without IC, whereas for us who have IC or have other types of chronic pain, we're going to feel the volume of that turned up all the way, right? Allodynia or pain, right, it highly increases when we are experiencing nervous system upregulation or central sensitization, right? So it's sort of like everything is kind of dialed up and our body kind of loses its ability to understand what's a threat and what isn't. Everything kind of camouflages into itself. Often have patients who will report hypervigilance, panic, fear responses, right? Being afraid to talk to their family members about what they're experiencing. Even the toll it takes for many of us to go to meet a doctor for the first time again, regurgitate our entire story, explain that it's not infectious in origin, talk about what it is, how it can affect things, how it speaks back to other organs, right? Most of us are often educating our own providers and are taking that labor on. And the enormity of that is, it goes without saying, right? The time that you have to take off from work, organize childcare, organize whatever you might have to restructure or reorganize, right? To just get to these doctors, say the spiel over again, tell them what works, what hasn't for you, right? All of it is part of the emotional cost of IC. So to tie this back into therapy, therapy can really help you address the above by offering a validating and affirming container to process feelings, name your experiences, right? That's often a big part of this, and really move through the complexity of emotions that are often associated with IC. Right, so I like to highlight that beyond just a really wonderful relationship and a wonderful opportunity to reflex, as I like to call it, or to look inward, therapy can also just help you name and track your experiences. Sometimes most of us don't even know, we're not even aware that we're experiencing medical gaslighting, right? We're not even aware that perhaps somebody is treating us differently for whatever reason until another unbiased set of eyes can help us bring that to the light and name that for us. So just interesting there. So the nervous system and IC, right? I'm really excited actually, because I feel like in the last couple of years, just the phrase nervous system is one that is entering, our brain space more and more, right? I'm hearing all types of providers, dietitians, nutritionists, all of us, right? Somatic coaches, we're all kind of talking about the nervous system. And why are we all talking about it? Because we all have one, and everything speaks back to our nervous system, right? Whether that's experiences we ourselves are front face, are interacting with or participating in front facing, whether that's vicarious trauma, whether that's loved ones that we might have who are experiencing symptoms of IC, all of the inertia that is accompanied by being a human being impacts and informs our nervous system. So again, to talk a little bit more about central sensitization, again, which is really when the nervous system becomes overactive and reactive to even the most minor of stimuli or threats. This is a main bedrock of our experience as someone who has chronic pain. So a lot of us will notice over time that not even our physical symptoms are now sensitized, but now emotionally, we might be more on guard. That flight-fight response that many of us have heard of, or language that might be familiar to us, that's amped up all the way, right? You might notice, even if you track your symptoms, let's say throughout, 3 years or so, you might notice that your response, your body carries the coding of that pain in a different way, just through the passage of time and through your nervous system being so accustomed to pain. So again, we highlight this, and it's a phrase that we talk about seriously in psychotherapy, because co-regulation, which is a big term in psychotherapy, is really about what can we do to get back in that window of tolerance, right? Which is where we want to be to kind of be at home again in our nervous system. Things like stress, violence, chronic pain, medical experiences of harm, they all push us outside of that window of tolerance, right? And when we are pushed outside, we all have one too. Part of what it means to be a human being is to exist and adapt and to adjust to any sort of stimuli that might be, distressing. But chronic pain typically pushes us, right? It ricochets us outside of that window of tolerance. And most of us tend to be hyper-aroused or hypo-aroused, right? Many of us that I notice who have IC tend to be hyper-aroused or in a state of hyper-arousal where we are on guard constantly. We're waiting for the next proverbial shoe to drop. We're waiting for another medication to not work. We are mourning and grieving maybe things that we used to partake in, things that we used to enjoy, things that were once accessible, maybe even things that we didn't ever have to think about, right? And most of us struggle and work tenaciously every day to get back into that window of tolerance, which doesn't mean it all goes away, right? It doesn't mean that we suddenly don't have IC or aren't, in pain anymore, but it means our nervous system has the ability again to help us co-regulate, to help turn that volume down, to help us still live again and not be subsumed by IC and all that comes with it. So flares, right? Similar to what I was just sharing, flares can be triggered by all matter of things, but therapy is really a space that's going to talk and highlight how flares can also be triggered many times, most often, by stress, trauma, and emotional overwhelm. I think many of us, right, because IC is often touted as a bladder adjacent, pelvic floor adjacent condition, there's not enough talk or dialogue about the emotional triggers that can really flare and up the volume on our pain or an IC related episode, right? And so I think therapy is really a space to bridge that gap where doctors and medical personnel often fall short, right? And it's a space where psychoeducation, learning can really happen about, oh yeah, not only is this rooted in bladder physiology, but there's a whole psychology component here that speaks back to the pain that I'm experiencing. A lot of my patients will often report that when they are stressed, their bladder or that suprapubic region will immediately start hurting. Sexual assault, childhood trauma, any type of trauma, political trauma, the world we're living in, it could be anything, right? Any number of these environmental factors can trigger emotional overwhelm, which in turn lives in the body. And we often notice our body screaming out, right? We'll often notice the first sign of a flare. So therapy really helps to re-regulate the nervous system, especially through, again, somatic and trauma-informed approaches, which I have found, being in the field for over 10 years, go far beyond just talking, right? Therapy is not simply just a venting space, which perhaps is something I want to demystify here today, right? certainly it's an opportunity to get things off your chest and share and talk about the frustrations of whatever it is. But it's really a targeted, intentional, deliberate space where your provider is really co-creating a treatment plan with you that's really rooted in evidence-based, collaborative care practices and tools that are not only helping you vent and process and get things off, your chest or helping you move things through your body, but it's also really a targeted set of skills to help you relearn how to find that window of tolerance again in your body, which in turn just helps you become more regulated in all areas of your life, pain notwithstanding. So the importance of integrative care. I know we all know this is part of our IC treatment plans, right? I don't know anybody now that doesn't understand the importance of pelvic floor PT, right? Water, tracking your food potentially, being aware of triggers, right? But oftentimes I notice as a therapist, therapy is not part of that integrative care. It's not part of that care team. I seldom meet an MD who recommends therapy as a first line treatment for IC, right? Oftentimes we're very quick to put in that PT referral. We're very quick to, right? We start trialing the emergency meds, right? The Urabels, the Azos, the Hydroxy, whatever it might be, right? We start pitching instills, right? We're going through the whole trifecta, but very often I notice that therapy is not part of that plan, right? So it goes without saying that the best care for IC is of course going to be a care plan that speaks to all parts of the self, the medical, the physical, and the psychological, right? And so to really speak back and to, ground and anchor us into that, therapy is absolutely going to be something that is just as important as your medicine, just as important as any daily meds you might be taking, just as important as any dietary changes or different toilet papers you might be trialing, different wands you might be using, right? Just as important as your PT, right? So just as most of us meet with pelvic floor physical therapists, right? Most of them do internal work and then you'll practice exercises on your own. That's very similar to therapy, right? You get a container each week, sometimes more. You get that hands-on work with your provider, right? It's not internal work, right? But it's emotionally internal work. And then you get a series of things to practice and really explore on your own in between sessions. And then you come back every week and you assess how you're doing. So kind of like PT is a mainstay for IC, for many of us who have that pelvic floor component, which is pretty impossible not to have, right? With IC, therapy is analogous to that. And again, therapy often bridges the gap between what medicine can treat and what the body is often feeling and saying, And so I like to sort of phrase it that way to really talk about how most of us really need a space to talk about the invisible components of this disease, right? A lot of us need a safe provider who's not only going to listen to you, but who's going to champion with you, who's going to be an ally with you, who can even speak back to some of your MDs, who can help you advocate, plan a pitch if you're not liking a medication, or if you want to trial something more explorative, like low-dose naltrexone, right? I'm making something up, right? This is something that most of my patients are trialing, right? But could be anything, right? A therapy is really there to help you think about your choices, think about how to talk to your partner, think about how to talk to your children about this condition, right? So love that. To continue along that point, right? I love therapy too, because it's like PT, it's accountability. It's a space designed and reserved just for you every week. It's a space where not only do you get to sort of share and unload, right? And to just have somebody whose eyes are on you for 45 minutes completely. You have their undivided attention. But again, it's also a container to have somebody to support you during unpredictable flares, right? It's also there to have somebody to help you advocate for medical accommodations, work accommodations, work from home accommodations. I have written so many letters to back up clients who have IC who cannot commute any longer, where they need to be working at home, right? So it's not even just the talking space. We can offer you so much, right? Beyond the modalities, the accommodation letters, whatever it might be, right? Helping you with disability paperwork, helping you, whatever it might be. But we're also here. We're somebody that you can contact in between sessions when you're having a really low point, when a conversation didn't go your way, when you really tried to get somebody that you love to understand the condition and they didn't. We're here to process that with you and to help explore it with you. Right? So again, it can help a lot with self-advocacy in medical settings, which a lot of us, chronic pain puts a lot of us in a state of hypervigilance, which in turn then can make it harder to speak up for ourselves when perhaps we're not happy with a care plan, we're not happy with a medicine that our doctor might be pushing. We think that there's a piece of this that they're not getting, right? Or maybe it's impacting our interpersonal relationships. Maybe we're feeling self-conscious because we can't partake in that glass of wine at so-and-so's wedding, right? Or maybe we're having a lot of fear around flying and we want help in speaking to an airline about making sure that we get our preferred seat that's near the restroom, right? Family members, right? Speaking to our children, speaking to our bosses. How do we talk about IC to other medical personnel that's on our care team, right? Our PCPs, our OBGYN, right? Could be anybody, right? And so I really like to highlight that therapy not only helps you unpack and process, but we can help you advocate in ways that medical establishments take very seriously. It also goes without saying that IC is a suicidality risk factor, right? Like all chronic pain increases suicidality, right? Flares, pain, all manner of our body not working in concordance or working the way that we want it to, all has the ability to increase our risk for hospitalization and for suicidality. So again, it's something that I really take seriously. All of those advocacy efforts can really help to increase quality of life and to really highlight the importance of disability care, right? Even if you are somebody who doesn't identify IC as a disability, helping you get more accessibility points in your life that would just overall help your quality of life and help you move back towards that window of tolerance that I've been speaking about. Right. So again, support and working through grief. Something that I think is totally understated when talking about IC is the grief, the bereavement, the loss of self, the loss of identity, the loss of who we once potentially were. And some of us have IC from extraordinarily young ages as well. But for many of us, this recently has come up, right? Or it's something that we're noticing in perimenopause or menopause, or it's something that we're noticing with another environmental factor. Or some of us get a UTI, treat that, and then we're left with lingering symptoms, right? Like there's so many causes behind what induces us into the world of bladder pain. But the grief is something that I really want to pause and speak to. Sadness, not being able to do things in the way you once were able to do them, right? Really reckoning with what life looks like now is something that I think therapy is instrumental with. And also just processing experiences of harm. IC is a condition that oftentimes goes years without getting diagnosed properly. Many times people think it's a UTI, they think it's something else. Like many of us, right? There's often reports of spending many years taking countless antibiotics, waiting to finally meet with a provider who understands that this is not an infectious disease in origin, and that rather it is a multimodal complex pain syndrome that speaks back to several different parts and aspects of the body, most namely the bladder, of course, but it's more dynamic than that, right? It's not simply just a bladder pain condition. And so I think some of us haven't even gotten a chance to process that time lost in many ways, right? Or the agony in misdiagnosis, or even the overwhelming grief in finally meeting a provider that gets it, that understands, and that tells you what's really happening. Right? So many of us go through countless trials of things. We go through countless exams, right? Cystoscopies, urodynamic testing, right? CAT scans, MRIs, ultrasounds, whatever it might be. And many of us still don't have a diagnosis of IC. We're still waiting for that. And if we do have it, for many of us, it's come much too late, right? And so I think that's something that gets to really be present and centered in that therapy container where you get to be held in that. You get to be, you get to be held in that anger, that resentment, that upset at this medical model. So, and then lastly, right, a therapeutic alliance really can help reduce shame, and it really can help to rebuild confidence in the healing process, which is something many of us struggle with. The shame of having IC, losing our confidence, not knowing how to move in the world again, not knowing how to claim ourselves again, right? And also just, it's a great space to rediscover who you are outside of IC, which I think is really important. So let's talk a little bit about trauma-informed care and chronic illness. Right, so kind of what I was saying a bit ago, right? So many things can also inform who gets chronic pain, our exposure to chronic pain, our variables, right, that can increase our propensity in getting chronic pain. So therapy can really be a beautiful space to talk about any sexual trauma any of us might have experienced, medical trauma, childhood trauma though, right? It doesn't have to be IC connected necessarily, but many of us can have moments of trauma, experiences of trauma, firsthand or secondhand, that also can speak back to nervous system sensitization, right? And again, so when the nervous system is moving through a trauma swell, as I like to call it to many of my patients, or a trauma response, we'll notice that IC symptoms can tend to worsen, right? And again, therapy that is rooted in trauma-informed care really prioritizes radically listening to you deeply and actively, right? It can be easy to hear people, but to listen takes a concerted effort. It takes a different, more radical, in my opinion, framework of really dropping in to what the person is saying and meeting them energetically in that reportage of their pain or their experience of their trauma, right? So therapy that is rooted in trauma-informed care, which I believe is the gold standard and should be the baseline, right, is really going to not only center your experience of pain, but it's going to refrain from pathologizing your experiences and your symptoms. And what do we know from this medical model? We know that very often we are at risk for being pathologized. We're at risk for people telling us that IC is all in our head. I still get patients who meet with me every week that are telling me that their clients or their providers are telling them to simply just drink a glass of wine and to relax. And that, right? It's 2025, folks, and providers are still saying that. So I'm just, highlighting that. So one thing that I really love and stand by in my profession is that we are here to actively depathologize your past and any experiences that you might have. We're here to do just the opposite and to really highlight and drive home how real your experience is. Highlighting that word real. So, and again, to speak more about that, right? The complexity of who you are is not only welcomed, but it's honored in therapy. We're not simply just curious about who you are, but we're charismatically welcoming you with open arms. We want to know about these details. We want to know who you are. We want to know who you are outside of IC. We want to know a little bit about your own relationship to self, who you are, who you've been, where you want to go, what you want to do with this data, right? So therapy is really a beautiful container that emphasizes consent, right? It emphasizes safety, it emphasizes empowerment, and it also emphasizes autonomy. So many of us only get 15 minutes at most with our providers, our medical providers, right? Unless we're going out of pocket where we might get a little bit more time. Many of us are rushed in that room. Many of us don't even get a chance to talk about the emotional toll IC is taking on us, right? And so therapy is really there to not only help you understand your nervous system more, but to learn more about trauma. And trauma really is a physiological event. I always tell people that trauma is less about what happens to you, and it's more about what is happening inside of you. And granted, those two go hand in hand, but trauma really happens on a neuronal level, right? It happens molecularly, where now suddenly you don't recognize yourself. You're in a completely different nervous system and body operating than you once were. And therapy is vital in helping you retrain and re-regulate some of what might be happening on autopilot, if that makes sense. Evidence-based tools, something that I really love to talk about. So a lot of us in this room right now might be familiar with acronyms like CBT, DBT, right? These are some of the frontline modalities that can be excellent in just helping folks redirect negative cognitions or all or nothing thinking. CBT, because it is a cognitive-based modality, it's really rooted in helping you change your thoughts to help you arrive at a different feeling state. So many of us with pain or IC, we can tend to catastrophize, right? Not our fault. We can tend to be locked in on a negative cognition, right? Maybe I'll never get better, or I'm never going to have sex again, or my partner's going to leave me. These are all examples of negative cognitions. CBT and DBT stands for dialectical behavioral therapy, can both really help to get folks out of that all or nothing thinking, right? To help us get out of that autonomic response where suddenly we've just decided that it's never going to happen, right? Now or never again. I like CBT and DBT for chronic pain because it really can help us shine a light on the distorted thought and arrive to a neutral thought, or just one that is more neutral. Doesn't even have to be a positive thought necessarily, right? Because it's really hard to unthink a thought once it's arrived. But there's a lot of tools under CBT and DBT that can help at least support you in remembering the other data that exists and helping you lock into a more neutral frame of mind, right? Like, it feels really despairing right now. And I want to remind myself that I've had really good days and intimacy and pleasure is still possible, right? So we're not totally positivifying, right, the negative cognition, but it helps to sort of remember, wait. We've got resources, we've got people on our side, we've got ourselves, and we have still positive data. Even in the most negative of times, there's still data that exists that can help us reroute and redirect some of those cognitions. Somatic therapy, another word that's entering the mainstream in a wonderful way, right? Somatic, just a fancy way of saying the body, right? It's a therapy that's really rooted in enhancing that mind-body connection and helping us really pause. A lot of us move fast, right? The world moves fast. Helping us pause, slow down, and understand the mind-body connection. Helping us understand diaphragmatic breathing, right? Where do we know that from? Most of our PTs, right? Helping us pause, helping us understand, oh, what's my body telling me? How can I listen more deeply, more intimately to what my body is saying? And also, when my body is good, how can I believe it? How can I actually believe, oh, wait a minute. I just ate an heirloom tomato with mozzarella and I'm okay. And my body's okay. And I'm not going to second guess it, right? And I'm going to be mindful. I'll be watchful, but I'm going to just celebrate the fact that my body gave me data and I believed it. Where many of us, I think, we're so overstimulated by being in pain or the thought of a flare happening that even when our body is giving us positive signals, it's really hard to believe it. Feels too good to be true, right? Sometimes. And so somatic therapy can really help slow us down, connect to the breath, which many of us don't do correctly or do in haste, right? But it can really help us to not be afraid of our body in the same way and to learn how to reconnect with the body. Along that, we've got mindfulness, journaling, meditation, right? Different types of grounding techniques, tapping. There's so many interesting body-related, mindfulness-informed techniques that can really help also ground the body and help that sensitization and help to sort of downregulate the nervous system. And then there are some really nice trauma-based modalities that I really love. EMDR is one. IFS is one, right? IFS stands for Internal Family Systems. EMDR is eye movement desensitization and reprocessing therapy. Couples work. So again, therapy doesn't just need to be for you. It can also exist to help your loved ones understand your condition more. It can also exist to help strengthen and bolster your relationship intimately, right? Many of us go through a learning curve where our partners don't quite understand what it is we're describing and saying when we say that we have IC. And sometimes it takes bringing them into a therapeutic container for them to really hear from a third person, right? A little bit more about how it's affecting you and how it's affecting the relationship as a whole. So, identity, intimacy, and insight. I love this slide, right? Because most of us forget who we are beyond us. Many of us forget who we want to be and the parts of ourselves that we want to reconnect with, right? So therapy can also be a container to reshape and body map and play with intimacy in a different way, right? How can we access pleasure again in our body whilst navigating complex pain? And how can we re-engage our body image, right? And self-esteem again. Many of us can't wear certain things, right? We have to be mindful of what might feel too tight. Right? There's so many things that I see speaks back to in terms of our body image and our self-esteem. And I think therapy can really provide an invaluable space that can really hone, wait a minute, how can we restore certain parts of self-esteem or body image or intimacy or identity that have gotten lost or pushed to the wayside because of IC? Relationship health, right? So I love also therapy because we can't talk about IC without talking about our interpersonal lives, right? We can't talk about IC without talking about how it affects our relationships and how people might perceive us, right? So therapy can also be a great space, even if you're not doing couples work, right? Your therapist can certainly help you with couples communication tools, help you talk about invisible illness and ways to advocate, ways to speak up when you feel like somebody might be negating or erasing or invisibilizing you. We can really talk about that isolation and the guilt. A lot of my patients talk about the guilt that they're not able to do as much with their kids. They're not able to do XYZ with their partners. They're not able to do whatever it might be, right? But just the guilt that can come from that, the shame that can come from that, and the isolation that often results in that. So again, major takeaways, right? Therapy, I like to say, is not a bonus cherry on top. It's an essential part of any care plan for any human being, actually, chronically ill or not. And I stand by that. So IC or not, therapy is invaluable, and it's a space just for you, right? It's your own personal cheerleader that's backing you up, helping you identify negative thought patterns, challenging you, pushing you, right? It's not just a space to be coddled. It's also a space to think radically about what you can do, what you can choose to step into, boldly, powerfully, right? It also offers a space for pause. IC is hectic. It's demanding, right? When we're not in the doctor, many of us are self-soothing at home. When we're not at PT, many of us are doing what we can to manage flares or to manage the recurrence of flares, right? When we're not learning more about the disease, many of us are doing free labor, educating others, right? So much goes into this disease. Therapy offers a space for reflection, for pause, for psychoeducation, for diagnosis, if you're interested in it, right? For coping tools, regulation building skills, nervous system regulation that we've talked about. But also you deserve a space reserved just for you and your story. You are worth that. You deserve that. A lot of therapy is covered by medical insurance. Many folks have access to therapy in some way, shape, or form through a commercial insurance if you have. And also if you don't, many options for low cost or more affordable therapy exists as well. So just know, right, therapy in some way, shape, or form can be built in to whatever budget you have, whatever access points you have. Many folks offer pro bono therapy. So therapy is there's always a way to get you to a therapist if you need one, if you want one. And these are just some invitations for the audience to consider, right? Some questions that I just posed, right? So the first one, what does healing look like for you beyond more bladder-related comfort? What do you want your healing to look like? Who are you beyond this disease? And who do you want to claim? What parts of you do you want to claim again for yourself? How do you think therapy might help and support you and your relationships, right? So even beyond IC, what are ways that therapy might help you just in general, right? What are ways that it might help anxiety, depressive symptoms, other trauma-related symptoms, right? Third question, can you make room for therapy as vital as meds, PT, visits with your urologist or UroGYN, right? Can you fit it in? Can it become something just as important for your care plan? And then lastly, what might become possible for you again in a therapeutic space? I love this question the most because a lot of us forget possibility in the face of chronic pain and chronic illness, right? We feel like most things are actually impossible. And therapy is a wonderful space that can really help remind you again what still exists, what is still here for you to grab at. What can you still claim as yours? And that last question is often the hardest question I find in many of my clients, myself included, as a patient, right? I often forget what's possible. And I'm constantly surprising myself by what I was able to do that day in any given day. And I think that's magic. That's magic, right? And so think about these questions. They're just here to consider. For the sake of time, we'll move forward, but I can always send them to folks who might want them later on. We'll put them in the chat. Resources that I just like to give to folks, right? Notwithstanding ICA, which is an incredible, incredible resource, but in finding a therapist, I really like Psychology Today, cornerstone of how many of us find a therapist. You can plug in your insurance, you can plug in your state, you can plug in what you're looking for, you can even plug in the identities of the provider that you are hoping to have, right? So many of us feel better when we're talking to somebody who can share sometimes in some of our identities. Doesn't have to be an exact match, but right, for many of us, we're looking to have folks who can really understand the nuances of identity in different ways. And so I think Psychology Today is just awesome. Another website that I really love and stand by is Inclusive Therapists. Inclusive Therapists also has many plugins. I'd say Inclusive Therapists is rooted also in BIPOC communities, gender expansive community, immigrant communities, disability forward communities. So I really, really love their website. They've got numerous providers on there that fit all sorts of identities, not just the acronyms that I stated above, but right, folks who are looking for sliding scale, folks who are looking for in-person options, folks who are looking for specific modalities, folks who want to combine modalities, right? So I think Psychology Today and Inclusive Therapists are awesome. Then we've got the International Pelvic Pain Society, which is just a nice website that can talk more about resources with pelvic pain, talk a little bit more. They've got sometimes webinars and interesting things on there that I think are interesting and valuable for patients. And then ISWISH, which I really like, isswsh.org, does a lot of genitoureteral pain webinars. Different providers, MDs, often will do talks on ISWISH. So just another nice resource to have in your toolkit. All of these websites I can vouch for and have interacted with folks, directors at all four, and speak highly of all four. So, and then some more resources that I like. These are just books and different things to keep track of that I think can be helpful. The Body Keeps the Score is often a book that we hear often. Bessel van der Kolk, just a great, great book on the nervous system and how pain, PTSD, all sorts of trauma can impact us. I think it's a great, a book that most of us have on maybe our bookshelves, but a great addition if you don't. Insight Timer is a great app, right? It offers free meditations for pain, anxiety, and trauma. Right, again, it's going to be a supplemental tool. It won't be your main bread and butter, but it's something nice if you're on your phone, you notice that you're doom scrolling, whatever it might be, right? We're saturated by all of these accounts all day long. I like it because it's free and it offers a nice drop in to just pivot. If you notice that you're overly consumed by something you're worried about, I don't know, a cystoscopy coming up or an instill, or maybe you just want to ground and root and get your mind off of that. I like that app. Another book that I really like is The Invisible Kingdom, Reimagining Chronic Illness by Megan O'Rourke. Just a really beautiful book about, again, playing with who you are, playing with the fullness of who you are. IC can often, right, it can feel like it reduces so much of us. It dilutes us in so many ways. But I love this book because it really talks about reimagining that and refilling our cup that IC has stolen from us in some ways. And I like the title Invisible Kingdom because, like many chronic illnesses, chronic pain syndromes, most people do not recognize or validate our pain for what it is unless they physically see something, right? They undermine IC in a lot of ways. So Invisible Kingdom was a cool name that I really liked. And then the Bearable app I really like. You can track your flares, your food, you can track stress in that app. It's also another free app, right? So if you want to have something to track your cycles, hotter months, colder months, temps, moments when you had the flu, moments where you trialed taking away certain foods, adding certain foods in, right? I just think it's a nice app to sort of house all your data, utilize it for your doctors, utilize it with your therapist, utilize it with your PT. So some references. Thank you, ChatGPT, for using these images. So we've got that. That was the only thing that ChatGPT was part of for this PowerPoint. And then this is my contact information. If folks ever want to contact me for whatever reason, I'm always here, right? You don't need to be a patient to contact me. If you need resources, if you need referrals, whatever it might be, I am licensed in a lot of states. So I happen to know a lot of providers in many, many states across the United States. I'm based in New York City, so most of my referrals are New York City based, but also Connecticut, Jersey, the tri-state area. Here's my LinkedIn, my website, and I'm always here to listen and to connect. And if I don't have the answer, I will most certainly find somebody that does for you. Yeah, and that wraps it up for now, everybody. Thank you to everybody who's and listened. And I'm here. Yes.
Virtual round of applause. Goodness, what an excellent presentation, Sabrina. That was fantastic.
Thank you.
So we've got a few minutes where we can accept some questions from the audience. And so what I'm going to do, you can absolutely type it into the chat. What I'm also going to do, though, is if you want, we're going to turn on the microphone feature. So if you want to unmute and ask a question, you're welcome to do that. There is a hand raising feature at the bottom of the Google Meet screen. It's literally just like a hand and a palm. If you'd like to unmute and ask a question, please feel free to hit that, and we'll have you unmute and ask a question. But like I said, you're welcome to also type it into the chat. While people are thinking, I do want to ask, I want to go back to, I'm so glad you talked about medical gaslighting. Can you give an example of that for the audience?
Absolutely, absolutely. So an example that comes to my mind is a patient recently who was having irritative bladder symptoms for quite some time, kept going to doctors, right, was moving through referral to referral, finally met with a urologist. And an example of the medical gaslighting that I like to describe is that this patient literally came prepared with all of these things, right, logs, a data of her symptoms, referral from the PCP, right, was ready. Came in saying, hey, I really think that I have IC. I really feel like I meet the diagnostic criteria for this. Example of medical gaslighting, the doctor literally says, you're too young for that. You couldn't possibly have that. No, based on your prior imaging, you don't have that. Nah, people get that when they're older. This was literally the response that the doctor gave my patient. That is an example of medical gaslighting. So, right?
Perfect example.
Yep.
Yes.
Yep. So just, yeah, No, go
As
ahead.
we know, anyone of any age, race, sex, etc., can get interstitial cystitis. I know personally my symptoms started when I was 14 years old.
Oh, wow.
And I know a little bit about having providers tell you, oh, you're too young for that. I get it,
Exactly, Laura.
unfortunately.
Yep. So that's a prime example, right? Gaslighting really refers to somebody who is making you disbelieve your own reality. Somebody who is saying something that lopsides your whole reality and doesn't acknowledge, affirm, pause to even honor your experience, your account, your own telling of the body you live in, and just sort of dubs it off as no way. Yeah. And so thank you so much for that question. Yeah.
And I think sadly, I think a lot of us have experienced that at some point in our journey, whether it's part of the diagnostic or treatment journey. And sometimes we don't see it necessarily when it's happening, but I bet a lot of us could look back and be like, wow, yep, there was that instance. That was a perfect example of gaslighting. And I think it's important to reiterate to folks that if you feel like you're being gaslit or you're having your experience invalidated, it's okay to seek care from another provider, to stop seeking care from that provider, to seek different care. And I think to your point, obviously being able to unpack that and process that in therapy could be incredibly helpful. So
no, thank you so much for saying that. Absolutely. I stand by everything Laura said. You do not need to be married to a provider at all. There are providers out there who will not gaslight you, and therapy can help you break away from that relationship, find a new, because it can be scary to terminate care when there's so little of us who know what I see is, right? So, but it's not impossible, and we do exist. Yes.
Yes.
Yeah.
And the ICA does have a healthcare provider registry. So I encourage everybody to come to our website and check that out.
Absolutely. I've seen it. It's wonderful. I've been on it myself.
Any questions from the audience? Just checking the chat. You know, the one thing I just want to add before we close is I really appreciate you mentioning this idea of medical trauma, because I think a lot of folks, as we've gone through the diagnostic experience or even just the treatment experience post-diagnosis, have been treated in ways that, and I know I even myself have been hesitant to use the word trauma, but as you look back and you realize what that experience was for you and how you were treated and how you felt after that, I think it's important to acknowledge that some of us have experienced medical trauma.
Yes. Thank you for saying that. Yes. And I think therapy can often help you identify too what falls under trauma, right? Not everything is trauma. Right. And that can be confusing when we're in a world right now that is saturating us with the word trauma. We're seeing that word come up a lot. So I really, to speak to Laura's point, I really like therapy too, because it can help identify, what's mistreatment versus trauma, or what's harm versus trauma, or even what's trauma versus medical violence, medical negligence, right? Sometimes all of these words feel like they're synonymous, but they're not. And so your therapist can really help you parse through, this is what this is, and can help you understand why.
Yeah. Well, thank you so much. Incredible presentation. I appreciate all of the very important topics that you addressed in your presentation today. As we wrap up, I just want to remind folks that you can connect with the ICA in a variety of ways, obviously through the monthly speaker series, but if you visit our website, you'll see a variety of options to get connected through us if you'd like to get on our communications list. We have an award-winning magazine that comes out twice a month. That hard copy goes to folks who have donated $50 or more in the past few years, but everybody gets the digital copy for free. We also have a monthly research digest where we work to translate timely science back to the community so that you can make the most informed decisions. And like I mentioned, we're very active on social media, including Facebook, Instagram, and LinkedIn. If you're looking for an online community, we are there. So thank you so much again. Another virtual round of applause for our wonderful presenter.
Thank you so much.
Thank you for your time. Thank you to everyone who has joined or might be watching the recording after the fact. And I wish you all the very best of the rest of your day.
Take care, everybody. Wishing you all the blessings and healings. Thank you so much, Laura.
Absolutely. Thanks all.